Hello, how are you today?
I'm good, how are you?
Good. Can you tell me your full name and date of birth?
Promise Gordon, 7/2/2000.
Awesome. I'm Maya. I am going to be your nurse practitioner today. What brings you in?
Just a physical.
Okay, so I will go ahead and we'll do a comprehensive head-to-toe assessment today. This will give us a better picture of your overall health, and we'll go by systems. Do I have your consent to record this and to do the head-to-toe?
Yes.
Awesome. How did you get here today?
I drove myself.
Okay, and what's today's date?
October 30th, 2025.
Perfect. I'm just going to do some hand hygiene. I'm going to take your vitals. Vitals were within normal limits. And then just looking at the patient, general appearance, she appears to be in her mid-20s. She has good posture. It appears like she has good cognition, and also good speech, no signs of distress. Moving on to the head and neck, just looking at her head, she looks symmetrical, hair distribution looks even. I don't see any lesions or any deformities. Is it okay if I go ahead and look through your hair?
Yeah.
Okay, I'm just gonna be looking through her hair. I don't see any lice. I don't see any rashes or lesions. Hair distribution is even. Scalp looks appropriate for her size and age. Any tenderness when I feel around?
No.
All right, good. Moving on to the neck area, her trachea looks midline. Can you go ahead and just swallow for me? Good. I don't see any lesions on the neck or any swelling. I'm just going to go ahead and palpate, okay?
Okay.
Thyroid. Any tenderness?
No.
Alright, good. I am going to go ahead and feel your temporomandibular joint. Go ahead and open your mouth for me. Good. Any pain with that?
No.
Okay, I didn't hear any popping or cracking noises, so that's good. I'm going to go ahead and feel for your lymph nodes.
Okay.
Your pre-auricular, you have your posterior auricular, tonsillar, mandibular, your submantle, occipital, you have your deep cervical chain, your superior cervical, posterior cervical, and your supraclavicular. Any tenderness with any of those?
No.
Good, they seem to be mobile. I'm gonna move on to your eyes now. So for our eye exam, just kind of taking a peek at your eyes. I don't see any exudate. Lacrimal apparatus is intact. Your sclera appears white. I don't see any lesions. Your eyebrow or your eyelash distribution seems even. Yeah, I'm gonna go ahead and just do some visual tests with you if that's okay.
Okay.
For the first one, I'm gonna test your peripheral actually. So I'm gonna make a wiggle motion with my hand. You tell me when you can start to see that, okay?
Okay. Now. Now. Now.
And we'll do this side.
Now. Now. Now.
Perfect. I'm gonna have you take a look at my pen here, and then take a look at the wall, and then back to my pen, and just follow it in. Good. I'm gonna test the 6 cardinal positions here with the eye, so just follow my pen and try not to move your head at all. Good. Extraocular eye movements seem to be appropriate. I'm going to go ahead and take a peek at your eyes with my pen light. Just look straight ahead for me. I'm going to shine this light in your eye. This one. Good. Your pupils are equal, round, reactive. They're brisk. I'm going to go ahead and take my scope and shine that in your eye to kind of take a look at your optic nerve or your optic disc. Okay. Go ahead and you can just look at the top of my ear. It's going to be a bright light in your eye. Good. Good. Your optic disc is intact along with your retina. It appears to be pink, just like we like it. I did not note any other abnormalities or deformities with the eye. So I'm going to have you stand up. And if you could just go ahead and read the chart, the lowest line or the smallest letters that you can read. You're going to cover one eye.
Okay.
And go ahead and read the smallest line.
A-L-T-Z-X-A.
Then cover your other eye and do the same.
M-T-Z-G-A.
Awesome. You can go ahead and have a seat. That was testing your cranial nerve number 2 with the Snellen chart. Next, I am gonna test your corneal reflex. So I'm gonna go ahead and kind of just touch this cotton ball to your eye. All right. Good. Good. Got a little on your eyelash. All right. I'm gonna go ahead and test your cranial nerve 5. I'm gonna have you close your eyes for me. I'm gonna put a Q-tip on your face. Let me know where you feel the Q-tip.
Forehead. Chin. Cheek. Nose. Cheek.
Awesome. And then continuing to test cranial nerve 5, can you go ahead and puff your cheeks out for me? And smile. Raise your eyebrows. Stick your tongue out. And then flex your neck muscles. Perfect. I am going to go ahead and just feel for your jaw strength. If you can open your mouth and move your jaw side to side. Good. All right, moving on to the nose now. Just by looking at your nose, general appearance, everything seems symmetrical. I don't see any visible deformities or any lesions on the nose. I'm just going to go ahead and palpate if that's okay. Any tenderness?
No.
Good. Can you go ahead and block one nostril with your finger and take a deep breath in? And then do the same with the other side. Good. The nostrils appear to be patent. I'm going to go ahead and palpate again, just to palpate your sinuses this time.
Okay.
Good. I'll feel down here by your cheek too. Okay. I'm gonna shine a light, and we are gonna just gonna shine this light kind of above your eyebrow. I'm gonna have you close your eyes for this, and this is gonna take a look at your sinuses as well. Perfect. And the other eye. Good. We're gonna do the same thing with your cheek, and open your mouth for me. Awesome. And good. Transillumination of sinuses is intact. Moving on to the mouth, or actually I'm going to take a peek inside of your nose too with my scope. All right, I'm going to have you tilt your head back for me. Good. I don't see any nasal polyps. I don't see any swelling or redness. Nostrils are patent. And I'm actually going to move on to your ears.
Okay.
So I'm just going to go ahead and take a look at them. Your ears look symmetrical. I don't see any deformities, no redness or swelling. Is it okay if I go ahead and palpate?
Mm-hmm.
All right. Just palpating the auricle. Any tenderness?
No.
How about with the tragus?
No.
And what about with the mastoid?
Nope.
Good. We'll do the same thing over here. Any tenderness?
Nope.
How about here?
No.
And over here?
Nope.
Awesome. All right. I'm going to go ahead and get my scope and take a look inside of your ears. And I'm just going to go ahead and pull the auricle up and back. Good. Tympanic membrane is intact. I don't see any redness. And we'll do the same thing here. And we'll pull the auricle up and back. Good. I did not see any redness over there. Your tympanic membrane does look intact as well, no swelling. I'm going to do a couple tests for your hearing. Have you ever noticed any loss of hearing?
No.
Okay, perfect. I'm going to have you pick an ear and you're going to cover it. And I'm going to whisper 3 words in your other ear. Let me know if you can hear them and then repeat back to me.
Okay.
Drink card pink.
Drink card pink.
And then cover your other ear. And rain blue food.
Rain blue food.
Perfect. I'm going to go ahead and use my tuning fork. And this is just going to be used to test your hearing as well. I'm going to make it vibrate a little bit and put it on the top of your head. Let me know if you can hear it equally in both ears or if you can hear it better in one versus the other.
I can hear it well in both.
Okay. And then we'll do it again. This time I'm going to go ahead and place it behind your ear. Let me know when you stop hearing it. And then I'm going to place it just beside your ear and let me know when you stop hearing it then, okay?
Okay. Stop. Stop.
Perfect. We'll go to this side.
Stop. Stop.
Perfect. No signs of any hearing loss just from those tests. I am going to go ahead and move to the mouth now. I'm just going to go ahead and put some gloves on. And just real quickly, moving back to the nose, I'm going to test your cranial nerve number 1. I'm going to have you close your eyes and I'm going to put an object close to your nose. Let me know what you smell.
Coffee.
Perfect. And now we will go down to the mouth. Putting some gloves on. Just by appearance, the lips look pink and moist. I don't see any cracks or lesions on the outside. I'm going to go ahead and grab the tongue depressor and my light. Can you stick your tongue out for me? Perfect. Just looking inside. Tongue looks pink and moist. No lesions on there. Hard palate is intact. No deformities with that. No swelling. Looks pink. I don't see any patches. No missing teeth. Can you stick your tongue out and say ah? Good. Uvula is intact and mobile. Perfect. I am gonna go ahead and move your tongue side to side. And look at your soft palate. Can you stick your tongue out for me? Good. Soft palate intact. No swelling. It looks pink and moist. No lesions on the soft palate. Good. And then I am going to go ahead and test your gag reflex. If you can just go ahead and stick your tongue out. Good. All right, can you go ahead and stick your tongue out for me? And then just move it side to side. Good. And then I am going to just do some range of motion with you. Can you move your head forwards and backwards? Good. And then what about side to side? Good. Any tenderness?
No.
Good. All right, now we're going to go ahead to our respiratory part of this assessment. So just by looking at you, your skin color looks appropriate for your ethnicity. Your thorax is symmetrical. Your AP ratio is appropriate. It does not seem like you have any work of breathing. Your breaths are unlabored, not using any accessory muscles. I don't hear any audible wheezing or any other sounds to note. I'm going to start by just palpating. So I'm going to have you take a deep breath for me. Good. Chest expansion is symmetrical. And then I'm just going to have you, I'm going to move your hair over here. And I'm just going to have you say 99.
99, 99, 99.
Good. Tactile fremitus is equal bilaterally. I'm going to go ahead and grab my stethoscope. And I'm just going to take a listen. I'm actually going to percuss first. So I'm going to go ahead and percuss your backside here. And I'm going to go laterally. And then I'm going to percuss anteriorly too. So I'm just going to move your hair. We'll remove this. And I'm just going to percuss over here. Good. Now I'm going to go ahead and take a listen. Just going to have you take some deep breaths for me. Listen over here. And over here. Good. Now we're going to look in the back here. Take a few deep breaths. Okay, I hear vesicular breath sounds. Your inspirations are a little bit longer than your expirations, which is good. And those are soft in duration or soft in intensity. I am going to go ahead and take another listen, and I'm just going to have you say E and hold it, please.
Okay. E.
voice transmission is appropriate. I am going to go ahead and move on to the cardiac part of this exam. So if you want to go ahead and lay back down. And I'm just going to go ahead and look at your carotid and your JVP in tangible lighting. Which is good. I can see the pulsations, and I'm going to go look at the PMI in tangible lighting. Good. I am just taking a look at the carotid and the JVP, and I'm going to go ahead and palpate, finding a pulse for that carotid, which is good. And then I am going to find the PMI, which is mid-clavicular, fifth intercostal space on the left side, and we'll just feel for a pulse there. I feel the pulse to be brisk and short. Moving on from chest or from cardiac, I am just going to go ahead and take a listen. I hear the S1, S2, no adventitious cardiac sounds. I don't hear any splitting or anything else to note, no murmurs to note. I am going to go ahead and look for your cardiac bruits. So I'm just going to go ahead and use the bell of my stethoscope and look at your carotid. No bruits heard. And I am going to go ahead and measure your JVP. So I'm going to place my note card. I'm going to have you turn your head to the left, please. And I'm just going to place my note card medially here. And I'm going to use this at the sternal border, which looks like hers is just under 3. Good. And now I am going to move on to my abdominal portion of this exam. So just looking at you abdominally, your abdomen seems to be flat, umbilicus is midline, inappropriate. I am going to go ahead and just take a listen to your bowel sounds. And now I'm going to listen for any bruits in the aorta, renal arteries, and the iliac arteries. Good. I'm going to go ahead and percuss. So I'm just percussing all over the abdomen. And I'm going to percuss around the liver here to just measure our liver, and we'll percuss over the spleen as well. I'm going to have you take a deep breath in. Good. And then another one. Good. So I'm just feeling for any enlarged liver or spleen, which I do not feel. Now I'm going to palpate your quadrants. I'm not sure if I mentioned, but bowel sounds were heard in all 4 quadrants earlier. I'm going to palpate the quadrants. Just let me know if you have any tenderness. Any tenderness?
No.
All right, I'll go just a little bit harder. Any tenderness?
No.
Good. I'm going to go ahead and just test for your abdominal reflex. So I'm going to make a couple different lines. I'm just going to roll your pants a little bit down. Okay. And now I'm going to have you sit back up for me. And I'm just going to kind of tap your back in a couple places. Let me know if you have any pain with this, okay?
Okay.
Any pain?
Nope.
Any pain?
No.
Good. Circling back to our respiratory portion of this exam, I'm going to go back and do something called a diaphragmatic excursion. So that is, I'm going to go on the back side of you, and I'm just going to tap your back a couple times. I want you to take a deep breath in, let it out, and then hold it. Okay, take a couple normal breaths for me. And then when you're ready, I want you to take a big, deep breath in and hold that without letting it out. Okay, diaphragmatic excursion is appropriate and equal. Great, now moving on to your upper extremities, I'm just gonna overall assess your appearance. Posture seems good and upright like we discussed before. I think your extremities look symmetrical. I'm just gonna, I don't notice any deformities, swelling, anything like that. I'm gonna go ahead and just feel for your bony prominences. The skin, while I'm feeling, is warm and dry. And we'll feel this arm as well. Skin color is appropriate for patient's ethnicity. Just feeling these bony prominences. I'm gonna assess just her arm hair, which looks appropriate for her age and gender. Feeling down here for her cap refill. Cap refill is brisk, less than 3 seconds. I'm just going to go ahead and feel all your pulses with your radial to start. And then we'll move up to your brachial. Good. And we'll do your cap refill over here. Again, brisk, less than 2 seconds. Her radial pulse is +2 on her right side, and her radial pulse is +2 over here, and then her brachial pulse over here is +2, as well as it was on her left side. Just gonna go ahead and feel for her epitrochlear lymph nodes over here. Good, and we'll feel over here as well. Good. I'm going to have you stand up and we're going to do some range of motion. So if you stand here, we'll start with our shoulders. So we're going to have your palms out towards me, and you're going to raise your arms to the sky straight, and then put them down to your sides. And then we're going to do the same thing, but going outwards, and pull them in. I'm going to have your elbows tucked to your side here with a bend. And we'll go outwards and then inwards. And then I want you to go ahead and do your thumb behind your back here. And the other side. Good. For elbows, we're gonna have you stand like this. And you're gonna flex and then extend. And then I'm gonna test your wrist. So your wrist you're gonna have up and you're gonna flex towards you and then extend towards you. We're gonna do some supination and pronation. Good. And then moving on to the hand, I'm gonna have you flex your hands like this in a fist and then extend. You're gonna abduct your fingers and then adduct, pull them together real tight. You're gonna do the opposition, which is just tapping your thumb with your little finger. Good. And then to test your thumbs out, we'll have you go like this, and we'll have you flex and extend, and then adduct and abduct. Good. I'll have you sit back down, and we are going to test the strength of these. So I'm going to have your elbows up for me, and you pull towards yourself. Good. With your wrists, I'm going to have you have your hands out like this. You're going to pull towards you. Good. And then you're going to pull towards you again. Good. Go ahead and squeeze my fingers for me. Awesome. And then we are going to bring this table over, and I will have you have your hands abducted like this. And I'm going to have you I'm putting this little card in between here, and close your hands as tight as you can. Don't let me pull the card. Good. And then close your hands as tight as you can. Don't let me pull the card. Good. Awesome. And then lastly, just the opposition. So I'm going to have you have your hands up, and you're going to do that stance where you touch your finger with your thumb. And I'm going to just put my finger here and here. Don't let me rip apart your hand. Don't use this finger though, sorry. Don't let me rip apart your hand. Good. We'll do this one. Don't let me rip apart your grip. Good. Nice and strong. We'll move on to your lower extremities now. Just assessing your lower extremities from appearance. They seem appropriate for her body. I don't see any deformities. Again, the color looks appropriate for her ethnicity. I'm going to have you lay flat for me, and I'm going to go ahead and do some hand hygiene and get some gloves on. Right. At this point, I am going to go ahead and feel for your femoral artery right in this groin area, okay? And I'm feeling around for your inguinal your inguinal lymph node. And I'm going to do the same thing on the other side. I'm just feeling for that inguinal lymph node again. Good. I do want to listen for femoral bruise, so I'm just going to grab my stethoscope here. And I'm just going to listen. I'll listen on this side as well. I don't hear any bruise or any whooshing sounds. Moving on with my exam, we will do some lower. I'm actually going to go ahead and feel for your cap refill and your toes here. Cap refill is brisk, less than 3 seconds. Her skin is warm and dry. No leg hair. Skin color down there is appropriate for ethnicity. I am going to go ahead and just assess more of her pulses, looking at her popliteals, which are +2. Her femoral was +2. I'll look at her pedal pulses, +2, and her posterior tibial pulses, which are also +2. So pulses look good, capillary flow looks good. We're gonna go ahead and do some range of motion. So first we're gonna do the hip. I want you to bring your knee to your chest in a bent motion, good. And then I'll have you straighten it out. I want you to go ahead and flip your body. And I'm gonna have you extend that leg and do the other one for me as well. And you can flip back to your front. I think you all had only raised this one, so I'm gonna have you do the same thing over here where you do knee to chest, good. And then I'm gonna lift your leg up for you, and I want you to bring this one towards me, good. And you can move it back and then move it out the opposite way as far as you can, good. And then I'll go over here and we'll do the same thing. I'll lift this leg up and you move that over, good. And then move it out the opposite way, good. I'm gonna have you, we'll go to knee and we'll come back to hip. I'll have you, for your knee, drag your heel to your lower thigh area, good. And then extend for me and do the same on the other side, good. Extend for me. And then I want you to flex this quad muscle so that your knee kind of divots and your heel lifts, good. And same over there, great. I'm gonna have you sit, actually if you can scoot down on the chair a little bit, I will have you rotate your toes kind of inward, good, and then outwards, good. And then I'm gonna have you come back over to the side of the bed. And then I'm just gonna have you do the same thing, rotate your feet in, yep, you got it, and then out, good. And then we'll do the same thing over here, in, and then out, good. And then for your ankle, I'm gonna have you flex your ankle up and extend it down, good. We'll move down to your toes. For your toes, I want you to flex them in, good, and then kind of spread them out, good. And then we'll abduct. If you can spread your toes apart, good, that's abduction. And then adduct, bring together, good. We're gonna do some strength tests. So I am gonna have you raise your knee up for me, good. We'll do the other side here, good. I'm gonna have you pull your leg in, good. Pull your leg in, good. And then kick out, good. Kick out, good. And then don't let, or push my hand up for me, good. Push my hand up. And then push down. Awesome, push down, awesome. And then we'll do grip strength. So if you can just squeeze my fingers for me. Good, you have great strength. I'd say 5s on both extremities bilaterally in all the areas that we had tested. Now we're gonna move on and we're gonna do some neuro tests. So while you're seated, I am actually just gonna start some of the seated tests. So just by speaking with you at this physical exam, your cognition as well, your speech as well, I want to do a couple things. So I am going to tap your body with either something sharp or something dull. Your hands are going to be, your eyes are going to be closed. So you let me know where you feel it and whether it's soft or whether it's dull. Okay. If you don't mind just rolling your sleeves up for me. All right, you ready?
Mm-hmm. Sharp.
Where do you feel it?
On my arm.
Which arm?
Left forearm.
Okay. And then
soft, right forearm.
Good.
Sharp, left cheek.
Good.
Sharp, right foot. Soft, left foot.
Good. And now I'm going to place something in your hands. You're going to close your eyes and you're going to tell me what it is, okay? So stick one hand out and then you can feel for that.
Cotton ball.
Good. And then while our eyes are closed, I'm going to have your hand out again and I'm going to draw a letter. You tell me what letter it is.
A U?
Yes. Good job. Okay, so then moving on to more neuro tests, I'm just going to kind of move some equipment out of the way. And I'm going to have you stand up for me. You're going to just walk to the other side of the room and come back on your tiptoes. Good. And then I want you to walk down there on your heels for me. Her gait is appropriate. There's no tremors. There's no, she doesn't seem to have any problems with her coordination here. We're gonna do rapid movements. So I want you to go ahead and tap each of your fingers. Good. And then you're gonna go like this. You're gonna go like this. And then I want you to, you can stop doing that. And then I'm gonna have you touch your nose. And then touch my finger, touch your nose, and then touch my finger, touch your nose, and then touch my finger. Good. And then I'm going to have you do the same thing with your other hand. So touch my finger, touch your nose, finger, nose, finger, nose. And then I'm going to have you touch my finger and then close your eyes, touch your nose. And then good. You can relax and then touch my finger with your other hand, close your eyes, touch your nose. Good. Have a seat for me. And I'm going to have you rapid movement. Just tap my finger with your one foot. Tap, 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 tap. Good. Tap, 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 tap. Good. I will have you lay on your belly again. Sorry for all the positions. And I want your ankle to bend up and touch this back part of your knee. And slide your ankle all the way down. Yep. To the other one. You got it. Do it again. Good. She's staying in line with her shin, and you'll do the other leg as well. Same thing. So yep, bring that ankle up, down. Awesome. So I'm going to have you stand up one more time for me. I want you to go ahead and bounce in place. Good. Good coordination. And then I'm going to have you stick your arms out front, close your eyes, and don't let me kind of make you dizzy or fall over. Good. Just coming around you. Good. Good strength. Now moving on to reflexes. You can go ahead and have a seat with your feet off the edge again. I'm going to take my little reflex guide here, and I'm just going to have you kind of flip your arm, relax that hand for me, or actually, I'm sorry, this way. Relax that arm for me. Good. On to this side. Good. And then I want to really see this bicep. Relax that arm, get loose. Good. Good. We'll do the same over here. Relax this arm. Good. And then for this one, I'm going to have your arm kind of like this. Relax it. Good. And we'll do the same thing here. Relax this arm. Get loose. Good. All your weight should be on me. Good. Now I'm going to go ahead and do your lower extremity reflexes. So I'm going to go ahead and hit the knee here. Good. Good. And then we'll go ahead and we'll get the ankle here. Good. Go to the other side. Good, you have positive reflexes, which is a good thing in all of the points that we had tested.